taking the time to join us on this session. We're going to be talking about, on the next slide, the Hive. And we are joined on the call with a couple of our World Health Organization colleagues and myself, Živan and Jonathan. So let's spend just a few seconds just to introduce ourselves. Brian, I believe you're first on the list.
Great, thank you. Yes, my name is Brian. I'm a technical officer at WHO, and I've been actually on the Hive project for a year. So I started on the Hive project last January, but have been at WHO for 5 years. Thank you. Over to you, B.
Hi, good afternoon, good morning, everyone. I'm Dr. Latinović. I'm a technical officer in the WHO, and I've been in Hive actually for the last 8 months. Well, it has been quite an interesting journey and a lot of experience of being someone who is not from this story, from the tech development story, and being a very much of the practitioner, public health practitioner, to be part of the Hive. So it has been an honor and privilege, and I'm happy to share with you the experience.
Fantastic, thanks. And a lot of you already know me. I'm Mark Scrivener. I'm the MD of the London office of Momentum, a HTEC company. And I've been on this journey from the very, very start. I will talk you through on the next few slides on how this started and came to fruition. And I'll pass over to Živan now from the engineering department.
Thanks, Mark. My name is Živan Miljkov, and I'm in HTEC for almost 8.5 years. And for 2.5 years, I'm on the Hive project. So basically, after Mark, I'm the oldest in the team. And I'll pass it to Jonathan.
Thank you, Živan. My name is Jonathan Levi, Principal Product Designer on Mark's team in Momentum HTEC's London office. I've been with Momentum for a few years. I've been involved with the Hive project from a product strategy perspective mostly. I've seen the progression over the past couple of years, especially as we've gotten to where we are now. So very excited for the opportunity for the team to go through both where the Hive started and where the future looks. And I'll hand back over to Mark.
Cracking, thanks. So Jonathan, if we go to the next slide, the agenda for today, we've got an hour. We're going to be talking through why Hive, what is the Hive? And from that early conception of the idea, how that went from concept to product. And from them product, we're going to look at the future, and we're going to leave a little bit of time at the end for Q&As. And we've got a bit about what's the next steps. So let's go on to the next page. Right. I'm joined on this session with Ljubica. We're going to talk about why Hive. And Ljubica, I believe, first question. Let's have a few.
Yeah, well, you just asked the question, why Hive? It's good to know how this journey actually started and what was the initial thinking behind this project.
Brilliant. Okay, so from the very early time of COVID, there was a Gartner report of who do you trust the most to give you the reliable information in a pandemic. And we worked from June 2020 with the Wellcome Trust and with the World Health Organization to understand and discover how trust plays a part with it and how we can be better prepared for epidemic and pandemic responses. Who do you speak to? Where are the challenges? How has this all arisen, and how are we then going to be prepared for the future? So going on to the next hexagon, we wanted to delve into this problem space. We wanted to understand within prevention and preparedness how organizations are currently doing it, especially in the time within that summer of 2020. What is needed? How do you collaborate? What's the challenges you experience? So we delve into the problem space. We spoke to many organizations, faith groups, business organizations, manufacturing, travel, all of the challenges and different challenges they had, and really understanding how we can overcome this, but also distributing out the right information with trusted professionals who can then share that information and have a real impact, and we are then better prepared for the next COVID. So from understanding the problem space, understanding all the challenges, pain points, we then converged into a solution space. This is early stage. This is understanding, framing the challenge, framing the problem, and then starting to solutionize. Of course, we all know a solution from the very start is not going to be the answer and it's going to solve world problems straight away, but we've got all of the key ingredients to put into the melting pot, and how we can then put this through customer journey mapping, looking at the whole ecosystem, looking at personalization, localization, different challenges in different sectors, language, different communities, and how these communities can come together. So from that solution space, we then, in the next hexagon, started to create these pieces, and we started to work, and that's with the HTEC group and Momentum and the World Health Organization. We started to collaborate on what Hive could be. Now, I've got a question for you, Ljubi. After a few years of this development, what actually is Hive? And why is it so important to the World Health Organization? And what makes it so different?
So, yeah, that's a really good question. And for us, Hive is something really innovative and different, a platform that WHO normally wouldn't have or didn't envision to have, because it is more now of collaboration platform. It is the platform that brings different communities that are maybe not always related to WHO, could be even civil society, could be, our partners and stakeholders that work with WHO, but that are always need the information, need the tools, need how to know more about our preparedness for epidemics and possible future pandemics. So Hive, from that trustworthy source of information, now has developed and evolved really to be a collaborative space, a digital collaborative space platform where where the communities, different communities, can come together, co-create, co-design, and collaborate on the solutions and activities that can be scaled up. For example, if we have a new epidemic, hopefully not new pandemic, but let's be honest, we know that the situation that we had in with COVID-19 can be, and it's possible to be repeated. So this platform exactly will give us that go ahead and already be a platform with all the communities that would be working on pandemic and epidemic preparedness and response eventually, because all these communities can be activated fast because they are on Hive, in order to have a better, more sustained and more efficient response in any kind of health emergency, predominantly.
Fantastic. I mean, there was, Ljubi, I mean, there was a question you posed to me earlier, and I think that was about how HTEC worked with a UN agency, especially in the middle of a pandemic.
Exactly, especially, the health agency, so global agency, because, the agency that really represents, 7 billion people, or takes care, or we'd like to say that we serve the 7 million people somehow. So how, I think it's interesting question or for me, it would be interesting also to see how was that different than any other project that Momentum or HTEC, does.
Yeah, I mean, it's a huge beach to the World Health Organization, and the organization and the connections and the communities, like you say, it's billions of people. And so how do we do that? Large organizations are not necessarily on speed. They don't go at a fast pace, but shifting this into a product mind space, shifting this into a collaborationist space, and how we work together. And the interesting thing here is this is a perfect example. Because of COVID, it was remote working. And because of remote working, we had to test how we're going to work together over Zoom, over Teams, over conversations. And we had an opportunity to come and visit you in Geneva for a few sessions. And that was really interesting for the face-to-face, but also the challenges that COVID presented are the challenges that we have right now. It was the new shift mindset of working collaboratively online Or where can we do pieces offline, and how do we get the right information and be succinct and share all of this throughout? And so that was a good challenge. But I think the most important thing here is everybody I've worked with has got a positive mindset, and that's something really key about that. I think we've spoke about what the Hive is and what the concept of the idea would be, and so I think now let's shift into the next page. Now let's look at what this is from concept, our initial ideas and vision and strategy, and how that transformed into a product. And Živan and Brian will walk us through the next few slides in a bit of a fun quiz way.
Yeah, thanks, Mark. I'll start. Yeah, as we will go one step in more detail. So the first concept started in June 2021. And we had in focus people that didn't know where to look for the right information during the pandemic, as information could vary from region to region. So probably we're all in the similar situation. And organization needed to have some central place where they could access information and also collaborate with people encountering a similar situation. So this was the start of the Hive platform, and which has ever since evolved and is positioned for the next health emergency. For me personally, it was the first time that I have worked with non-profit organization that is present in every region in the world. And as also Mark mentioned, so the agile processes employed during the software development were tailored to align with WHO's operational preferences. So the primary focus remained on achieving a balance between user visibility, quality, and underlining technical components, not directly evident to the users, and also having in mind the time component. And Brian, how did it look from your side?
Yeah, thank you, Živan. And this isn't the first time that we've met today. I have to say that I see you more than I see my family, and so from our side, it's really important that we, work with a really trusted partner, that we have a good working relationship and way of working. And so when I actually came onto the project, I have to say that a lot of the hard work and foundations was actually put in place, and so. I really do need to I want to use this opportunity to thank some of those visionaries that started this project. Sylvie Brion for actually having this vision to start this project, actually even before the pandemic, of wanting to connect networks and communities and people together. Sarah Hess for initiating the project, Kevin Crampton from WHO IMT, and also Catherine Sheridan, who actually did most of the heavy lift. And actually the platform wouldn't be here without her work. But they do say that the last 10% is 90% of the time and the hardest work, which is what I put in my reports. But that is definitely made easier because of how we've been working together. There are other engineering companies out there, and I have to say that, you know what, they probably would be able to make something quite similar, but with working with WHO is a different beast altogether. We have very time demands. Resources aren't always available on time, or actually in vast quantities. And so with a client where I'm always probably demanding front-end results, working with Živan, it's amazing that you keep as calm as you do, and that you understand what our needs are, what it is that we want to achieve to make the platform what it is today. And so let's test that relationship out. Let's see actually how well we actually know each other and the project. And so we're going to do a Mr. and Mr. quiz. And so let's see, what's the first question?
So the first question comes from my side. So how many years have I worked at HTEC and still working?
And you said this in your introduction, so it was 8.5 years. That was
Yes.
right.
Exactly.
Yeah. So the next question is, how many digital projects have I worked on at WHO?
So let's say this is my answer, but I don't know if it is correct one.
You know what? If I count the ones that I had a partial project like participation in, maybe, but 4. They were the early detection of potential adverse events following COVID-19, and that was a social listening project. Looking at online sources, a health chatbot for vaccine safety, a Good Talk serious game. You can type these in. We wrote a paper about this, and also finally the Hive. So next question.
Yeah, what was the first working name of the Hive? So, as you came later on the project, so let's see if you know.
So I have seen this dotted around in files. Is it Epicenter?
Yes, it is. So yeah, basically it was the first word that we used, as it was COVID outbreak, and then we shifted a bit to the Hive as we wanted to gather people around information and collaboration, which is really now the focus on communities and connecting experts all over the world.
And you actually still see that on our URL. It's not just hive.who.int, it's still Hive Center. So we still have brought that forward. And so the next question is, how many different people from WHO have been sort of integral in the development of the Hive project? People that actually probably have started on the project but no longer on the project.
Yes, my answer is 4. So,
and you would know more than me because that was before my time. But yes, I agree. And who are they?
So there are Sarah, Tony, Kat, as you mentioned, and also John.
John, yes, he's gone to the MCM network with another very valuable networker at WHO, which hopefully we're going to invite on the Hive very shortly.
So what was the name of the first release in which you were involved? So one interesting thing that Brian was among the first users in the inside WHO, and it was before the official 1.0 release. So let's see if it.
So is this a trick question? Because I would put Hive 1.0, but I'm just going to put 1.1.
No, it's gamma release. So this is the pre-release. So we collected basically inputs from your user testing, so we can improve our platform.
I have to say, and boy, did I give a lot of feedback. It's probably why I'm sitting in the seat now. Because when Catherine reached out, we were. I was in the infodemic management team, and we were going through that platform because we could see the use case, and it was in our best interest to make it impactful. So great stuff. Next question is, how many cybersecurity penetration tests have been submitted and conducted by WHO? And so this is something that we have to submit to WHO to make sure that it is of the highest security. It's always a nail-biting time. I'd say I know how many in my time, so I've got to guess how many there has been before me as well. So actually, yours is probably the right answer. Yeah, so I've been through 3. I guess, it must have been about 2 before.
Yeah, exactly. So next question is, how many people from HTEC group, so together with MDL, worked on the Hive at its peak? So at one point, what was the number of people that were on the project?
So I know that the team was really big. I don't know if that's a clue on screen there.
No, it's not. It's not, but let's say maybe half of it, but a little bit more.
I'm going to guess like 30, 35.
Almost there. So it was 32. So back then, so at the beginning, when we worked for Hive 1.0, so there were several teams involved in the creation of the Hive. So we had front-end, back-end, machine learning, QA team, product manager team, product designer teams, and also project managers. So basically 32 people at a peak. And I must say that around 50 or 60 different people went through the project for these 2.5 years. And I would like to thank them all if they are on this call.
Yeah, I'd like to give my thanks to them. And it's really interesting that you say there were over 60 people, because it was from our side, it's seamless. We have our PMs, we have our QAs, we have yourself, we had Gavrilo that was running, the development team. No, that was Nicola, sorry, wasn't it? And Gavrilo. And also the other PMs, Alina and Tefik, that we work closely with. But the overall development team, doesn't matter, where it, ebbs and flows, gets bigger and smaller, the deliverables were always of the same quality. So okay, so this question is, so we did have a slight branding exercise. When did we introduce the bees into the branding? And can you name this bee for a bonus point?
Let's try. So the first, I think it was AI for Good last year when I was there. But for bonus point, I'm not sure, because I know that the first name was Hank. But let's see if I made it to see Luca.
It is Luca. So actually, one of the designers that we have at WHO has got a whole family tree of these bees, which he's named. So thank you, Anton, for doing this branding for us. And we did launch it at the AI for Good Summit last year in Geneva. Hope to again do that again this year and really talk about Hive 3.0, which Jonathan will talk about later.
And now, who is the gatekeeper of the release? So before the release is handed over to Brian, or before we deploy it to production, so who can say no?
Who can say no? Mr. Chuck Norris himself. Is it Goran, our QA?
Yes, exactly. So Mr. Chuck Norris, Goran. And I would add also one more person. So it's Monica from WHO side. So she is doing the penetration testing on our releases on UAT, and she can say no for the deployment to production. So those are two people that have the ability to say yes, no.
And in the penetration test, they did once say no, didn't they? And we had to go back to the drawing board. So, that is working with what happens when you work in a UN organization where we put, security and privacy, but it was also to their very specific requirements, which we need to, work around and adhere to.
Exactly.
So, final question is, how many communities do we currently have on the Hive?
My answer is 65.
You know what? I only did a last count last Friday in my weekly reporting, so I've not done it for this week. It could be 65, but I think it is. Last week it was 52.
I did some homework this morning, so
yeah, I need to do some extra homework. Well, actually, I think we did quite well. I think we do.
I was a bit afraid. I was a bit afraid because maybe participants will think that that we knew answers in advance. We just prepared them, but we didn't know the answers. So I'm glad that what we answered.
Yeah, and again, that is, on a daily basis. And on a serious note, though, it is, having that sort of trust in HTEC, in your team, and actually understanding, what our, goals, objectives are, what we want to achieve is so important. And so this is a bit of fun, but actually we do try and have fun so that, we're not always just complaining about, we want this yesterday. But something that we do want is to look at the future. And so maybe the next slide can come up, and Jonathan, over to you.
Well, thank you. And I've been involved in the project, but I learned a lot over the past few minutes. So that was a helpful quiz. So as I mentioned, I've been involved off and on, really from a more kind of strategic and oversight perspective on the Hive. And over the past few months, what that's actually been more geared to is where this goes into the future. So what we're seeing here is one of the, I guess, the 65th community inside the Hive, which is today's HTEC Days community, which we'll do a little activity at the very end of our session to try to get everyone involved and active in the Hive. But in the meantime, we needed to look at what that future looks like and how far can we craft this vision at this stage? Well, really, it's up to having that strategy that can turn into a roadmap. And what we know and what we've talked about, you've heard, is that getting these experts together to help prevent or at least build resiliency in what happened in COVID-19, but across any epidemic, any potential pandemic. And really the value is, scalable as well. When we have all of these minds together, now the context may have been out of that pandemic, but the product and the value and the eventual user base will likely scale well beyond it. And so how do we get there? Because that is, as Brian mentioned, maybe a 3.0 conversation that we can start having now in today, February 2024. So when we have a platform that allows these expert communities to get together, to collaborate, to build content, to schedule events, to host and iterate on documentation and guidance, that's really the first step. And that's where we're at. As these communities get onboarded and we go from maybe this kind of central source or core of activity into the greater global regional leaders per se, we look at this user base as the amplifiers, those that are able to contextualize and broadcast the content and material that's being created on the Hive as active members. And of course, they have constituents who may be leaders in their own communities themselves, and these are the catalysts. So what we see for the future of Hive is that the impact that the platform and the value that it's able to provide can get to every individual and every door in the world through these levels of leadership. And that helps us, understand the different community types and therefore who's going to be on the platform and who we're looking to onboard. But we do need to reframe these groups inside of our product perspective and maybe as user roles, as many people on the call will be familiar with. So by reframing our experts as creators, we understand who's responsible for generating and creating the content. And we can also ensure that the product decisions, design, development, and releases are adhering to what those requirements are and what value that's going to provide that core group and those first users. And then as we've gotten this product to a point every single day where it is continuing to evolve and iteratively getting to provide the value for those expert creators, we then look at onboarding the curators, those amplifiers. As I mentioned, it's about contextualization, but as and even more importantly, it's about the organization and the validation of that expert created content. So both acting as a way to distribute it, but even more importantly, a way to feed back and collaborate with those expert communities to make sure that the materials are relevant, timely, and appropriate for their constituents. The next step, we get down to these catalysts, or as we can term, really the viewers of this content. Now, we don't mean this in a passive way, but we mean this, really actually in an active way. So it's taking the curated Hive material, assets, resources, events, simulations, games, whatever that may be, and enacting them into those local communities and making the difference on the ground, and providing feedback to their leaders, the platform's curators, who in turn upstream provide feedback back to the original creators. And how and where these different tiers blend, we're yet to see, and the team will encounter as we go on this journey together. But having that high level understanding of that roadmap and that vision is key for us to start the journey together. This also gives us some ability to start thinking into the very near future as well, and how the product value can be focused around each one of these groups as the product continues to evolve. We've mentioned AI for Good being a key moment of brand for the Hive last year. And I think in years to come, and the partnerships and collaborations that everybody's going to be involved in on that side, on the Hive side, clearly they're a driven team continuing to evolve and open up the horizons of where this project started as something born inside of a pandemic, to then grow outside and really be a limitless platform across good. And so where we see the AI coming in is around this expert community, ensuring that the content is both accurate, but also reducing things like redundancy or building on the materials that have already been created. Bringing experts together, both inside of their own communities, but from adjacent communities as well. Adding validation, adding perspective where needed. Now, it's important to obviously have a singular vision and perspective on things, but sometimes you do need that diversity of thought. And this is a place and a way that we can ensure that. And then learning back from how those resources, how those materials are being understood and utilized, and taking that data and then empowering those creators to ensure that their next evolution of that same material or the next iteration, the next initiative is going to be applicable. On our curator level, as we get into the next phase of the product, we can look at how we can best not just allow organization, but really discovery of materials and the summarization, the enabling individuals to be able to contextualize it better, maybe not even having to do some of the heavy lifting, understanding and recognizing those patterns to best equip. And as we go from left to right on this, we also understand that there'll be less maybe cadence of engagement as well. So we want to make sure that we're providing instant value and we're accelerating that time to it more and more so as we go down all the way to our viewers and catalysts, who will need these resources, these information, whether it's actively, passively, whether they know it's happening at all, but they'll need it at the right time, at the right place, with a much lower cadence of engagement as well. In a perfect world, these type of products wouldn't necessarily need to be here, but we've learned in a very hard way as well that they do, and that we need to be at the forefront of crafting this future. I'll hand back over to Brian now. We've looked a bit at the vision and the roadmap, but how will we measure the success? And do we have an idea of what that would look like from the WHO's perspective?
Yeah, thank you, Jonathan. And I think this is the exciting part, really. What the phase that that we're in at the moment is all about actually facilitating and communities to do their work. But what you just outlined there is actually the wider vision of how do we prepare for the next emergency, and that is having this feedback loop, having people co-create and share knowledge. And so the first one is having that community involvement. It's not necessarily a numbers game for us. It's not just having people be on the Hive for the sake of it. It's actually having the right people in the right place, and actually being able to tangibly share information, initiate discussions, and the exchange of knowledge. And so what we also want to do is to have that cross-pollination of knowledge sharing, so that these communities are starting to be able to speak with each other, and not just bilaterally with WHO. Yes, we'll be able to provide expertise and do host Q&As for communities, but we want networks to connect with each other. And actually, it's not just, there are other platforms where you can connect with other people, but it's the strength of those connections that matters most. And what we feel is that the Hive can be that place where you can bring people together and strengthen those engagements and connections between each other. The third thing is the importance of having equal distribution, that geographical representation, that distribution of gender, experience, and also subject matter expertise. All those things are the key elements of making any community project or working group be able to succeed in their objectives. And so what we're all preparing for is the hope that this platform will be able to be of use and prepare people for the next emergency. So have that ability to be able to leverage and activate communities so that when they have questions that or issues that they want to ask, or provide them a platform to voice their concerns as well, that this place is for them. And it's also a place where we can convene networks, we can convene people and leverage expertise, and so that we are able to discuss these issues in a safe space and have some form of coordination so that we don't add to the barrage of information on the public space and add to the infodemic. And so with that, I think I'll hand over to Sean, and it's time for questions.
Thank you all. If you have questions, there is a Q&A box here, and we have one here for you all. What is the biggest risk in the next potential epidemic or disease, and how will WHO and Hive address or start preparing for that now? So I guess this gets to sort of the preparedness piece of the platform, that's great. We came out of the pandemic, we created Hive. We have high hopes for it and bringing those communities and those networks together. But now, does Hive play a role in either prevention or advanced thinking, preparing for the next pandemic, the next epidemic? So maybe you could talk a little bit about that.
If I can start, can I? Yes. Yes, exactly. That's the point of Hive. Exactly that question goes into the nitty-gritty of what we want Hive to be. And that's the platform to go, digital platform to go for the preparedness for the next pandemic. As I said before, we know that there will be a next pandemic. Nobody knows when or what will be that disease X. Disease X is even more complicated when you see it than maybe to have influenza pandemic, because, we know the virus, we know about the influenza, but we don't know about the disease X. So where do we see Hive in all this? We see that all the communities that we now are building and are coming to Hive are the communities that are already working on some kind of preparedness for something that might come in the future. They have access to WHO experts that can come to Hive and probably, share the knowledge of where we are at this moment, what are we doing, what are the initiatives, even on the regional and even country level, which for us is a big thing. So one of the things that Hive can do is really have that access to, let's say, to the latest knowledge and evidence of what's going on in preparedness space. So that's one thing. So communities can already have a kind of tools and a kind of guidance that they can, inside of their communities, prepare and facilitate the discussion that is going on and preparedness. Because what we see Hive for in this preparedness phase, we are all there, we are all talking, we are doing something in preparedness. It doesn't have to be every day, it doesn't have to be, constantly, but we are at the same place in contact with WHO. And if something happens and the disease X or any other disease gets us to the a new pandemic, then we will all be together on the same platform. We will escalate that response. We will know what to do. We will get the resources from the scientists and experts in the matter, and then we will be able to transfer that knowledge to the communities and our constituencies that we have in those communities very fast. I mean, there is no other and we will already be prepared because we have been engaged. I mean, the communities have been engaged already. So that's the biggest, I think, value that we see, that now we have the collaboration, we have co-creation, but then we have a fast scale up in case that the response is needed. So that's what Hive is all about.
Ljubi, can I just add to that? And most people know me that I'm gonna throw an analogy in here now. Fire, when you've got a fire station, and you've got fire engines, and you've got the fire brigade, and you've got everyone who's doing training, who's doing preparedness, who are ready. This is the case here, where we're starting to do lots of simulations and training and getting ready. And so you know your job when it happens, you know your role that takes place. And so what we're trying to initiate is the education, being prepared, but also prevention as well, and the education. So just like a fire fire brigade will go to a local school and tell them about that. This is how we can start to educate and start to grow without actually having, God forbid, a pandemic in front of us. So we are ready then. So we are trained. We are then prepared, and that's the whole point of getting the whole community prepared. Simulations, running it through, and that's how we can tackle that before it starts.
Okay, we've got a couple more questions that have come in. Interesting to hear how the platform evolved from the initial stages. What do you think is next for Hive in terms of technology advancements?
Yeah, if I can come in here, there are definitely, as Jonathan mentioned in the roadmap and the concept for the future, we definitely want to leverage more AI and machine learning, and actually use what's happening on the Hive, so that we can use data evidence and research and feedback to actually understand the connections, and actually how do we build stronger connections so that the working groups and work succeeds. That's what we're trying to achieve here. But also there are other technologies where we want to improve on the platform, simply by having better access to information. So whether that's using a chatbot, and all the features that we have on the platform are just tools. They're not supposed to be world-beating tools challenging the likes of Microsoft and Google. They are tools that actually just help the communities get together, collaborate, and co-work together. So, but our challenge is always to have that finesse to make it as simple and easy as possible for these communities to work together. Wonder if anyone else.
Brian, I mean, from the very start of the discovery and research at the very start, we had a challenge of, do you create something that's a technical beast that answers all the questions, but kind of does everything for the community? Or do you have the community driving forward and evolving that? And we know it's a partnership there. We know it's the community and the technology. So we want to make sure it's an enabler for the communities to be able to do what they need to do. So the technology is all driven from what the community needs to facilitate their day-to-day work, to facilitate anything to go into action on what's needed straight away. And that is anything from supporting throughout documents, throughout guidance, throughout communications, opening up channels, to localizations, to knowledge sharing. So it's all about the community will drive the next pieces of the technology, because that's what's going to enable them.
Great. We've got several questions now. So speed it up. That's my subtle way of saying speed it up. Is there a prioritization to countries where outbreaks are more likely to occur? How much will cultural differences affect how well prepared different health systems are? That's an interesting one.
Okay, maybe just fast. Yes, this is something that as a WHO, we really need to look into more. And this is obviously for the next steps of using the platform. For now, the platform has been used mostly on the global level, I have to say, but we are working really on promoting this more on the regional level and making Hive accessible to our regions and especially country offices, because you're right, some future pandemic will start somewhere, and we the calculations and the modeling that the epidemiologists are doing, they would know or can predict where that might happen. For now, what Hive is doing in order to have this accessible for our agencies, that Hive is already translated in 6 languages. So basically, those are all UN languages, except Arabic for now, but we are also working on that, and Korean. So we will be working in the future, for this platform to be used more on the regional and country level, so they have their own communities that are maybe those surveillance communities, that surveillance-based, community-based surveillance that could be part of the Hive community, actually, can be something that we will be exploring in the future. But yes, that's something we need to work stronger.
Okay. Next up, how will Hive keep sophisticated disinformation efforts from affecting preparedness, especially if there are bad actors during future pandemics? I don't know who wants to.
Brian, would you?
Yeah, so there are always going to be bad actors and disinformation that surround, especially in emergencies. It's actually trying to understand, teach people, what their motives are, why this information is being spread, and actually build capacity to social inoculate people so that they recognize disinformation when they see it. But specifically for the Hive, though, the Hive is an invitation-only platform where we only invite different communities of practice, working groups, networks to work, with a public health focus, but will be for civil society organizations as well to work on the platform in a safe space. And so that doesn't hamper our preparedness activities, but being cognizant and aware of the information outside of that sphere is really important for our communities to be working on.
Yeah, so there's a certain amount of vetting that goes into the membership on the front end. Okay. Good. So with the Hive, how far in advance do you feel this will give the WHO to predict the next pandemic? So Libby, I know you had talked about a little bit about all the epidemiologists and kind of how the work that they're doing and to predict these kind of hot spots. But how far in advance does that actually work? Are we talking 6 months? Are we talking 6 years?
Well, you don't know that. I mean, predictions are predictions. That's how they are called. There is no certainty in modeling, any kind of modeling. So we would not know that. We know where the risks are. So how can Hive leverage that? Again, if the communities somehow start talking or giving us the green light about something that is happening, or they're checking. The Hive at this point of time is not a surveillance platform. Let's be honest. It's more the collaboration in preparedness of what can happen. What kind of disease X can come, or any other disease. So there are other platforms. There are many platforms the WHO uses as a surveillance, where we listen. We get so many information. There is a big meeting coming every morning in WHO. We kindly call it Good Morning WHO, where you get all this, information. It's called acute emergency meeting. And you see from how many sources, basically, the epidemiologists, the surveillance people get the insights and information. So there is all the team. There is a much bigger team working on all that. So Hive can leverage the discussions between it. So Hive can leverage maybe on getting those scientists or maybe those modeling people in a community, and then they can talk more, or have that better predictions and discussions. But again, we have to understand the predictions are predictions. So we will not know for sure for how fast we can get that.
Yeah. Mark, Živan, anything to add on that one?
I think it's all about looking at what we can utilize and how we can utilize. And one thing, again, from the initial research discovery, really understanding where the value is in succinct information and prioritizing the messaging. So if there is something that is picked up within the morning calls, then you have to assess that and how that then goes through the triage into the communities. and how the communities respond. We can quickly spin up communities within the platform, and that can be done within seconds. And so having a nice process and procedure in place that actually everyone knows how to respond and to react and to prioritize. So that is the big piece here of that disinformation and misinformation, and all about the content and how the best content is shared and when and where and relevant and contextual.
Okay. So accelerating adoption with Hive in place now, what either prevents adoption from taking place in each country community healthcare system, or what could accelerate that adoption?
Yeah, shall I go? As I was saying before, I think we do have to do a better job of selling the Hive into, not even selling, sorry, but introducing the Hive into countries and regions. But it isn't one of our objectives is to get as many people on there. It's actually people on there who actually need to be on there and actually, want to collaborate and will have an impact. There are sort of sticking points that we know that we need to improve on the Hive, and one of them is being so this is another technology that we need to go in, is probably having a mobile app or having it mobile accessible. And so that's one of the key areas that we will be working on to be able to increase adoption in different areas.
And looking at it from a product perspective, to accelerate adoption, it's product-led growth. You need to understand from the users what they need, when they need it, how they need it, and contextualize it and then prioritize it into your roadmap. So this is all done about listening to your users and then applying it into what's the value for the community and the product.
Sure. Yep. Do you see Hive becoming a resource for individuals in each country to learn about what's happening specifically related to disease spread? Would end users like to have direct access to WHO vetted information, for example?
To be honest, I don't think that's what we actually want. We talk more about the community as such, as our user, and the specific communities for now that are working in some kind of preparedness, or they are interested. You have like tourism industry, very, very interested to be in the loop. Maybe they're not really working constantly with us, but they want to have a community that can have an access to those discussions, or maybe a specific WHO expert on the mass gathering during emergencies, or, and have periodically to touch base with them. Individually, no. That's a completely different story. Again, it would have a lot of security issues around that. We would, I don't think that's the idea at the moment. And so vetoed information, we would have to discuss what exactly we mean by vetoed information. Of course, each information during emergency like COVID or monkeypox or something like that, well, you have the information that you can share and other information that first needs to be evaluated and, risk managed behind that before you can release it. So it's a different protocol, but that what communities on Hive would have is basically access, absolutely faster access than any others, let's say, to an expert, matter expert for disease that we are talking about or the emergency that we are talking about. But that doesn't maybe mean to the vetoed information. That would be the information, that WHO can and should release.
Luby, that's a good answer on the countries. And Sean, I'm conscious of time, and we do have a perfect segue. Now we're looking at each country. If it's okay, I've got Jonathan just to open up the screen here. We have something, Jonathan, if you want to take the floor.
Yeah, thanks, Mark. So when we sat planning today what we were going to discuss, my colleague at Momentum HTEC, Sam Price, and I thought of potentially there's a way that we can actually quickly visualize how influential an expert community and how quick it could be spun up, right? And so we went through those slides looking at there's an HTEC Days community on the Hive, and somebody's already jumped to it. So if you want to pick up your mobile device, scan that QR code, we can actually see how these different expertises can come together with some common thread to help in a situation, to collaborate, to prepare, etc. So we've already got a few people come in. I'll let it go for a minute or two, and I'll do it myself as well. I have a feeling we're going to be quite regionally based, given the audience, but that's totally fine. Lots of technology on the call as well. You'll also see on your browser a link there, a CTA to join the community. This is all anonymous at this point. If you do want to get involved, stay engaged, please click that button and register your interest. The Hive team will get that that registration information, and you can be onboarded. You can be involved.